Your kidneys are two of the most underappreciated organs in your entire body. Right now, as you watch this video, they're filtering approximately 200 liters of blood every single day, removing toxins, balancing electrolytes, and regulating blood pressure. Yet here's the terrifying truth. Your kidneys can lose up to 90% of their function before you experience any obvious symptoms. Chronic kidney disease currently affects over 850 million people worldwide, making it more common than diabetes or cancer. Yet most people have no idea their kidneys are failing until they reach end-stage renal disease and need dialysis. Today, I'm going to reveal 5 critical warning signs that your kidneys are silently deteriorating. And sign number 2, it's so subtle that even many doctors miss it during routine examinations. By the end of this video, you'll know exactly what to look for and when to take action. Let's start with something you can observe every single day, the appearance of your urine. Now, I'm not talking about occasional bubbles that disappear quickly. I'm talking about persistent foam that resembles beer froth and lingers in the toilet bowl for several minutes. This foam indicates proteinuria, the medical term for excessive protein in your urine. Here's why this matters. Your kidneys contain approximately 1 million microscopic filtering units called nephrons. Each nephron has a specialized structure called the glomerulus, which acts like a sophisticated sieve. In healthy kidneys, the glomerular filtration barrier prevents large molecules like proteins from passing into your urine. Specifically, it blocks albumin and immunoglobulins, keeping them in your bloodstream where they belong. However, when kidney damage occurs, this barrier becomes compromised, allowing proteins to leak through. The presence of protein in urine creates surface tension, generating those persistent bubbles. This isn't harmless. Proteinuria indicates glomerular damage, which can result from diabetes, hypertension, glomerulonephritis, or autoimmune conditions like lupus. Clinical studies demonstrate that even mild proteinuria significantly increases your risk of cardiovascular disease and accelerates progression to end-stage renal disease. If you consistently notice foamy urine, especially first thing in the morning, request a urine albumin to creatinine ratio test from your doctor immediately. Here's the warning sign most people completely miss, and it's particularly insidious because it develops so gradually. You might notice slight puffiness under your eyes when you wake up, or perhaps your ankles seem slightly swollen by evening. Most people attribute this to poor sleep, too much salt, or simply getting older, but this subtle edema could indicate your kidneys are losing their ability to regulate fluid and sodium balance. Let me explain the pathophysiology. Your kidneys maintain fluid homeostasis through precise regulation of sodium reabsorption in the renal tubules. When kidney function declines, sodium retention occurs, leading to expansion of your extracellular fluid volume. This excess fluid accumulates in areas with a low tissue resistance, primarily periorbital regions and dependent extremities like ankles and feet. The medical term for this kidney-related swelling is nephrotic edema, and it differs from cardiac or hepatic edema in important ways. Nephrotic edema typically appears first around the eyes because periorbital tissue is loose and gravity-independent. As the condition progresses, you'll notice pitting edema in your lower extremities where pressing your finger leaves a temporary indentation. But here's what makes this sign so dangerous. The swelling often develops over weeks or months, so gradually that you adapt to it without realizing something is wrong. You might notice your rings feel tighter, your shoes don't fit comfortably by afternoon, or your face looks slightly fuller in photographs. These aren't merely cosmetic concerns. They're visible manifestations of declining glomerular filtration rate and compromised tubular function. Additionally, this fluid retention indicates your kidneys are failing to excrete adequate amounts of urine, a condition called oliguria. When combined with proteinuria, periorbital and peripheral edema strongly suggests nephrotic syndrome, requiring immediate nephrology evaluation. Chronic fatigue is perhaps the most common yet most dismissed symptom of kidney failure, but this isn't ordinary tiredness. This is profound, unrelenting exhaustion accompanied by cognitive dysfunction that many patients describe as brain fog. Let me explain the complex mechanisms behind this symptom. Your kidneys produce a crucial hormone called erythropoietin, or EPO, which stimulates red blood cell production in your bone marrow. When kidney function deteriorates, EPO production drops dramatically, resulting in renal anemia. This isn't simple iron deficiency anemia. This is a normocytic, normochromic anemia, characterized by adequate iron stores but insufficient stimulation of erythropoiesis. With fewer red blood cells circulating, your tissues receive inadequate oxygen, leading to profound fatigue, weakness, and exercise intolerance. But the fatigue has additional causes beyond anemia. Declining kidney function leads to accumulation of uremic toxins in your bloodstream. Compounds like urea, creatinine, beta-2 microglobulin, and indoxyl sulfate reach toxic concentrations, affecting every organ system. These uremic toxins impair cellular metabolism, disrupt neurotransmitter function, and trigger systemic inflammation. The cognitive effects are particularly concerning. Studies using functional MRI have demonstrated that patients with chronic kidney disease show reduced activity in brain regions responsible for memory, attention, and executive function. This occurs even before patients require dialysis. Additionally, uremic toxins disrupt your sleep architecture, causing fragmented sleep patterns and reducing restorative slow-wave sleep. Many patients develop restless leg syndrome, periodic limb movements, and sleep apnea, further contributing to daytime fatigue. If you're experiencing persistent exhaustion despite adequate sleep, combined with difficulty concentrating, memory problems, or feeling mentally sluggish, request a comprehensive metabolic panel including serum creatinine and estimated glomerular filtration rate, or eGFR. Your urination habits provide direct insight into kidney function. Pay attention to these specific changes. First, nocturia, waking up multiple times at night to urinate. Healthy kidneys concentrate urine during sleep, allowing you to sleep through the night. When kidney function declines, you lose this concentrating ability, a condition called isostenuria. Your kidneys produce more dilute urine around the clock, forcing you to wake up for bathroom trips. Nocturia occurs because damaged kidneys cannot respond effectively to antidiuretic hormone, or vasopressin, which normally signals your renal collecting ducts to reabsorb water. Without this response, you produce larger volumes of dilute urine continuously. Second, changes in urine color and volume. Healthy urine ranges from pale yellow to amber, depending on hydration. But kidney disease can cause notable changes. Very pale, almost clear urine despite normal hydration suggests your kidneys cannot concentrate urine properly. Conversely, dark, concentrated urine with decreased overall volume indicates your kidneys are retaining fluid rather than eliminating it. Some patients notice their urine appears pink or cola-colored, indicating hematuria, or blood in the urine. This can result from glomerular damage, kidney stones, infections, or even malignancies. Microscopic hematuria, invisible to the naked eye, often precedes visible blood by months. Third, oliguria, producing less than 400 milliliters of urine daily. This indicates severe reduction in glomerular filtration rate and often signals acute kidney injury or advanced chronic kidney disease. Oliguria represents a medical emergency because your body cannot eliminate metabolic waste products effectively. Finally, polyuria, excessive urination exceeding 3 liters daily. While this seems counterintuitive, early kidney disease can cause polyuria because damaged nephrons cannot concentrate urine. Your kidneys compensate by producing large volumes of dilute urine, leading to frequent bathroom trips and increased thirst. Track your urination patterns. If you notice significant changes in frequency, volume, appearance, or nighttime urination, these warrant immediate medical evaluation. Here's a warning sign that seems completely unrelated to kidneys, yet it's remarkably specific for advanced kidney dysfunction. Many patients with declining kidney function develop dysgeusia, a persistent metallic or bitter taste in their mouth even when they haven't eaten anything. This often accompanies loss of appetite and food aversions, particularly to protein-rich foods like meat. The mechanism involves uremic toxins accumulating in your saliva and bloodstream. As your kidneys fail to filter urea effectively, blood urea nitrogen levels rise dramatically. This excess urea is secreted into your saliva, where oral bacteria convert it to ammonia. The result is a metallic taste and characteristic uremic breath that smells distinctly like ammonia or urine. This condition, called uremic failure, becomes noticeable to both the patient and people around them. Family members might comment that your breath smells unusual even immediately after brushing your teeth. This isn't a dental problem, it's a systemic manifestation of kidney failure. The metallic taste and uremic failure typically appear when your glomerular filtration rate drops below 30 milliliters per minute per 1.73 square meters, indicating stage 4 chronic kidney disease. At this stage, you're approaching end-stage renal disease and may need dialysis within months to years. Additionally, many patients develop uremic gastritis and uremic stomatitis, inflammation of the stomach lining and oral mucosa caused by uremic toxins. This contributes to nausea, vomiting, loss of appetite, and further exacerbates the metallic taste. The taste disturbances often lead to protein malnutrition because patients avoid meat and other protein sources. This creates a vicious cycle. Inadequate protein intake accelerates muscle wasting, weakness, and immune dysfunction. If you experience persistent metallic taste, ammonia breath, or unexplained loss of appetite, especially combined with any other symptoms we've discussed, seek immediate medical evaluation. These signs indicate advanced kidney dysfunction requiring urgent intervention. Let me summarize these 5 critical warning signs: persistent foamy urine indicating proteinuria, subtle swelling around your eyes and ankles, unexplained fatigue with cognitive dysfunction, changes in urination patterns, and metallic taste with ammonia breath. Here's what you need to understand. Chronic kidney disease progresses through 5 stages based on estimated glomerular filtration rate. Stage 1 shows minimal symptoms with EGR above 90. By stage 3, when EGR drops below 60, symptoms become noticeable. Stage 5, with EGR below 15, requires dialysis or transplantation. The key is catching kidney disease early, ideally in stages 1 or 2, when interventions can slow or even halt progression. Simple blood tests measuring serum creatinine and calculating EGR, combined with urine tests checking for proteinuria and hematuria, can detect kidney disease years before symptoms occur. If you have risk factors like diabetes, hypertension, family history of kidney disease, obesity, or if you're over 60, request annual kidney function screening. Early detection transforms outcomes dramatically. Many kidney diseases, particularly those caused by diabetes and hypertension, can be managed effectively with medications like ACE inhibitors or angiotensin receptor blockers, blood pressure control, blood sugar management, and dietary modifications limiting sodium and protein. Your kidneys are resilient organs, but they need your attention. Don't wait until you're facing dialysis to take action. Which of these signs resonated with you? Share your experiences in the comments. If this video provided valuable information, subscribe to our channel for more evidence-based medical content that could save your life. Your kidneys are depending on you.